Well, I want to express my gratitude to the Lincy Institute for choosing my project, which is very important for the health of Southern Nevada. I apologize that I have a cold, and I'll try not to get into a coughing fit as we go along. But my project was to partner with the Southern Nevada Health District to do a first phase of a strategic community assessment. So I thought I would start out by asking, what's the difference between Nevada and Mississippi? I was going to say a third world country, but I couldn't find the right statistics. Well, one difference is that Mississippi spends 3 times the amount of money that we do on public health. And I've put the reference there if you want. We're 51st. We spend $3.41 per person. Mississippi spends almost 3 times that amount. And Hawaii is a special case. I believe they have some sort of single payer insurance there, but shows you the median at $30. And this figure doesn't really even reflect the fact that some money from outside sources, such as the tobacco settlement funds, are seized by the state and spent on other things, whatever they feel like spending it on. It was meant to be spent on public health, but it's not. Now, I know the university has quite a urban sustainability movement, and when we hear about urban sustainability, we often think about water use, green buildings, that sort of thing. But the one resource that is just sort of lumped under the social aspect is health. Without a healthy population, Las Vegas is really not sustainable. You have to have healthy workers, you have to have healthy children, you have to have healthy seniors. And it's really a resource, not only in Nevada, but throughout the country. The medical industrial complex defines health as the result of when I treat you for illness, then you become healthy. But really, health is a resource. So the latest poll that came out, I'm sure you read this in both of our papers, the Opportunity Index, and Nevada ranked at the bottom in all 3 categories, including the community score. And these were the parts of the community that it looked at: civic engagement, volunteerism, youth economic and academic inclusion, safety, access to health care, and access to healthy foods. And this group ranked Nevada as the worst. So I just sort of give you those factors to tell you under what circumstances the Southern Nevada Health District labors to try to maintain the health of Southern Nevadans. And they have very limited resources. I'm on the Board of Health. This budget period, the county refused to give the correct amount of money to the health district. I think it was $12 million that the health district was entitled to, but they decided not to give it to the health district. And so the health district has had to sue the Clark County commissioners. And they got a preliminary judgment that the county was owed that money, but the county appealed that. So now it's going to the state Supreme Court. And this, I don't know how long this will go on, but this is really pretty silly. One of the goals of the Lincy Institute is to attract more outside funding, and that seems to be the way the health district is going to have to proceed to improve the health of Southern Nevadans. And in order to get outside funding, one of the things that the health district needs to do is be accredited. And that takes some resources in terms of doing the steps that lead up to accreditation. And so my project was to do one of the assessments in the MAPP process. I'll explain more about that in a minute. And to help structure the remaining assessments, and then to seek some external funding to complete this assessment process. So the National Association of County and City Health Officials, or NACCHO, has this process where it talks about community themes and strengths, and then the local public health system assessment, community health status assessment, forces of change assessment, and these are completed to assist a local health department proceed in the accreditation process. And to date, the health district had not completed any of these. So they asked me when I approached them about possibly partnering was to conduct the what's right with our community part. And then we'll see proceeding from there where we went. So according to the website for NACCHO, it's supposed to provide a deep understanding of the issues that residents feel are important by answering the questions, what is important to our community? What about the quality of life? And what assets do we have? Now, there's probably a dozen, 15 people here. And if I were to ask each of you to write down what you think is important, you'd probably draw, those of you who are not native Nevadans might draw upon where you used to live to think about the things that were better there. And so the goal was to get a broad representation of the community and then to achieve consensus. So if you wrote down 4 things and you wrote down 7 things and you wrote down 2 things and you wrote down 3 things, how can we come together and get some consensus? Now, in an area with almost 2 million people and an adequate but somewhat limited budget, we really couldn't do, very broad-based community sampling. So what we did is we decided to convene people from community agencies who worked kind of at the sharp end, people who deliver services to the community, who have deep insight into the needs of vulnerable populations, minority populations, and so forth, and then to try to reach some consensus. Now, the goal was to have 50 individuals on one day and 50 individuals on another, see who came and look at the segments that were not represented, and then to proceed trying to track down the missing groups with some focus groups. So this is the matrix, I guess you would call it, that NACCHO recommends and the CDC for thinking about the community. So these are the people who are really involved in our local public health system. So the public health agency is easy enough. I guess that the size of the oval must indicate something, the importance. But so, one of the biggest challenges was putting together a list of representatives from each of these segments to invite them to begin with. I certainly drew upon the expertise of the health district, which has many partnerships in the community. I drew upon my experiences. I teach community health nursing at UNLV. And so with a combination of pooled resources and asking people for their listservs and mailing lists, we put together an invitation and invited about 350 people or agencies. And we asked the invitees that if they couldn't attend, to perhaps invite someone else in their agency or to pass it along to another agency. And had great support from a secretarial staff who put together these email lists and the invitation and provided a consistent telephone number for people to call and RSVP. So we held one afternoon meeting and then a morning meeting. We had about 90 people who RSVP'd and said they would definitely be there, but about 62 showed up. And I think that sort of happens. People, even my own dean said she was coming and something came up at the end. She didn't show up. But we had a broad representation of the community there. And We brought in a technology of participation consultant, and she was masterful. The people who came to these large focus groups, which is really what they were. I think they were like, 35 on one day and a little fewer on the next day. But she had us working in small groups, answering particular questions, and then had these large sticky walls, she called them. They're sheets of fabric that she sprayed with material that sprayed with glue that construction paper attached to. And she was able to get consensus on many ideas. And by the end of that day, she had really done sort of a first cut on this qualitative data. We also asked the attendees to fill out a quality of life survey. And after the School of Nursing hired a PhD student to work with me to do some focus groups and to help analyze the data. Now here is a sampling of people who were able to attend. Although it says healthcare providers, we did not have anyone. We had no physicians, which was a disappointment. But on the other hand, it was asking for a 3 or 4 hour commitment of time, and it's difficult for many people. Remember that second slide about community, participation? A lot of people said they'd love to come, but their employer would not give them the morning or the afternoon off to participate. But we had a pretty broad representation. We did not have any local or state elected officials. We did have one who said she would be there, but on the morning of the event, she called to cancel. We had no one else who RSVP'd despite personal requests from me. Unfortunately, it was held during the time that the state legislature was in session, so many people could not attend because they were up in Carson City. So we had nobody from the media there. I later interviewed somebody from the media, and he said, well, how did you invite me? And I said, by email. He said, I never read those. I threw them all out. I said, well, how am I supposed to reach you? He said, I don't know. So, and he was the managing editor of a paper. So we went around trying to get some focus groups. We had limited success. We did get some school nurses, we got some social workers, and we did get print and online media. No luck with physicians. We tried pretty hard. Now, one of the strategies that the facilitator used, because people, when asked what's right with our community, they really want to tell you what's wrong with our community. So they would start out and say, our educational system stinks. And we'd say, well, how is that right with our community? And so it was quite a struggle to tease out what is right. The facilitator finally kind of allowed this feeling to come out by when these little construction paper things were stuck on her wall. She said you could write on a pink sheet of paper if you thought we were doing poor in that, and green if good, and yellow if okay. That seemed to satisfy people. So although they would say we need education, they were at the same time being permitted to say they thought we weren't doing very well in that. So all participants agreed on these themes. And community engagement is the ability of the community to care about and participate in community activities. The built environment, which was a surprise to many attendees, they'd never really heard of that term. Things like zoning, being able to put in housing developments with sidewalks, pathways to walk to school, places for people to congregate, lots of other things. They felt that the diversified economy was really key. They thought that education, people repeatedly said we're not a well-educated community, and we need to do something about that. Of course, that old joke about where do you get health care in Las Vegas, McCarran Airport is the access point came up. In addition to feeling that, when specialty care was needed, all the participants felt that primary care was not, there weren't enough primary care providers. Getting access to them was extremely difficult. Continuity of care was missing. Surprisingly, public safety was okay. It was the best rated. I guess that was before the series in the LVRJ about the police shooting people came out, but people felt that, okay for public safety. Here are some other things that we had consensus between one of the large groups and one focus group. They felt we were doing okay with cultural opportunities, but we could do better. Family support, we were not doing well. There was a mixed opinion on whether we have good government here. And they felt that having Lake Mead nearby and Red Rock were good for recreation, but there was a lack of neighborhood parks, and felt that we were doing quite poorly in the provision of social services. But again, these were important for a healthy community. In the focus groups, which were smaller, people didn't really have to come to such extensive agreement with others. Whereas the large groups had kind of lumped mental health services under health care in general, it came out of the focus groups that without more attention to mental health services, our community wasn't going to get healthier. And the public services needed to be provided at an adequate level. And an interesting theme came out that leadership was distinct from government. People drew on experiences in other communities where there were civic leaders who stepped forward with various missions and adopted a cause, perhaps. I note that Steve Wynn is now in Massachusetts in Foxborough dealing with the Patriots about putting in a casino. Wouldn't it be great if he adopted public health as his cause instead? That there's general disregard for our beauty of the natural environment. There needs to be more attention placed on that. So this is just sort of a frequency graph showing you how often these themes that I just talked about, I guess this little thing doesn't work anymore. Maybe it does. No. So you can see the items that came up in all groups, in 2 groups, and in fewer groups. So it's the same data. Now, it was interesting, the process to identify community assets. The facilitator set up I guess they're whiteboards or, these flip charts, I guess they were, throughout, and a map that I had mounted on styrofoam, and had various categories, what we're proud of in terms of history and so forth. And then we kind of culled these down into what were the things that people mentioned most often. And people were proud of the fact that wherever you go in the world, that people have heard of Las Vegas. That they were proud of certain charities, they were proud of the health district, they're proud of Hoover Dam, Nellis Air Force Base, they love the weather. The longest list on that flip chart both days was the voluntary sector assets. And that was sort of viewed as a positive and a negative. They said the reason we have so many private charities here is that the public sector doesn't provide these services, and voluntary sectors have to step up. Now, this is probably a little hard to read, but this was a 5-point scale with 1 being, I think 1 was the worst and 5 was the best. And we didn't break 3 on any of them in terms of quality of life. So of the people who came on both days, that was, oh, I'm sorry, safe place to live. We did break 3.04, which is sort of neutral. But everything else, they thought that we really didn't have this really wasn't a good place to raise children. They weren't satisfied with the healthcare system, wasn't a good place to grow old, and so forth. And I compared this with some data collected on San Antonio, and it was a few years ago, and the residents of San Antonio, I forgot exactly how they collected the data. It was more widespread than the 62 people, but their averages were between 3 and 4. So their residents were more satisfied with the quality of life there than our residents are here. And possibly it was because they had just spent 3 hours talking about what's wrong or what's right with Las Vegas, I don't know. Certainly some community segments were not represented, but it was a first start in collecting this data. So as a result of this process, we were able to return to the MAPP, and with the task force at the health district, Dr. Sands, Bonnie Sorensen, and several other people, we were able to use that data to complete the step for a vision for engaged, educated, and healthy community. And I've got some things pulled out of that in a few slides, but I'll pass this around. This was sort of a document that was produced. So I think that the people who attended were able to identify their vision of what would be a healthy Las Vegas or a healthy Southern Nevada. It was pretty clear. And it was an educational process for the people who attended. They learned some surprising things about the community, possibly. They learned some public health terms that they might not have learned before. I think what might have happened is I sent these emails to the newspapers, as I said, and on the day before or the day of the event, I think the RJ published an open invitation under community activities to the public to come attend. Although, you know, they were supposed to RSVP and all this stuff because there was a limited amount of space. And we actually had 2 private citizens show up. And one of them spent the first 20 minutes haranguing me about how I hadn't provided adequate information for him to find the place. And I said, I didn't mean to invite you. He said, well, you put it in the paper. So I said, that's right, I did. So I'm glad you're here. You tell us what you think. And so there were some partnerships that were developed. We had some people working at tables were changing cards, and it was good. I think we identified that the quality of life here needs improvement. There are many assets. It's a challenge to figure out how to harness them. And we have to get more community engagement. So this is kind of an excerpt from the paper someone just passed out for me. The 3 important words are in the title. The fact that it's an engaged, educated, and healthy community. Those were the themes that came out of the data over and over and over. And healthy public policy was a recurrent theme. And the fact that citizens want access to resources and services they need, and a safe and supportive environment. So here is what they value, broken down a little bit. So here are some of the things for community engagement. And, you know, employers really have to step up to the plate on this, because if they don't allow their employees to engage in civic life, I mean, one of the hospitals that I called and I asked them to send anyone to represent the hospital segment, they said, oh no, we've all got things to do, we're too busy to come. UMC did send someone, which was good, but another hospital told me they were too busy to send anyone. So it's going to take a while to change. And that we really need visionary leadership, both public and private. I read again last night the most recent Brookings report. It came out November 15th about economic diversity, and it talks about the need for leadership. Education, I was struck by Gwen's presentation. You know, the students saying education isn't valued, and maybe that's because there's always such fights over funding it that it appears that the community doesn't value it, you know, and it sort of is reflected. So, and they really thought that a key to diversified economy is a more educated workforce. We have to get above a 50% dropout rate. And health, accessible health care, and not only looking at health care, but looking at the social determinants of health, and that would support public policies that promote health and prevent disease. The fact that our legislature allowed, you know, more smoking in pubs kind of flies in the face of public policies that promote health. In environment, it's not only you know, water and air, but let's see, recreation, connection with nature, cultural. Many of the people came up and said that they thought one of the strengths of Southern Nevada was our cultural diversity, and we need more recognition of the contribution of the built environment to promoting healthy, active lifestyles. I was reading about if you live in Denver or if you live in Colorado, the peer pressure is on exercise and being outdoors, and people have walking trails in their backyard. And here we have to get in our car and drive, you know, 10 miles, 20 miles to find some place to exercise. So what progress have we made? Well, the health district is proceeding with the MAPP process, using the data from this first assessment to complete the other three. And the long-term plan is to seek accreditation in 2013. And all of the results of this assessment will be used to write a community health assessment and community health improvement plan. The health district did receive almost a $62,000 grant from NACCHO to complete the remaining assessments. That was received last month. And they took some of that money and gave it to UNLV. It's a subaward to me to complete 2 of the other assessments. There were only 4 of those grants awarded in the country. And we think one of the reasons the health district was awarded is we had done the first step of it and said, now we just need some money to do the others. Once the health district is accredited, it's going to be much more competitive for federal grants, primarily from the CDC. There's a feeling that health districts that have not gone through the accreditation process will not be as competitive. So I had sort of put in some of the Lincy Institute's goals and objectives. This is support the viability of the economic future and the quality of life for its residents. We've identified the baseline of where we think we are in quality of life and where we need to go. A new model for bringing together state, regional, and for-profit and nonprofit agencies. So we did bring together many agencies. Some issues came out that will have to be addressed in the other assessments. But it was good to get that dialogue going. And we did get some small amount, well, I just copied and pasted this from my final report, but so there's nothing attached there. But, provide baseline data. So we do have some baseline data. And once the other assessments are completed, there will be more baseline data so we can measure again in 3 years and see how we've gone. So, any questions I could answer for you? I see some people from the health district up here. Sean, you must have a question. No.
Interested where you're at with the second series of the assessments for the community health assessments and when those are going to be done, and if there's any way we can assist with those.
Yes, well, I think that David can probably speak to that, but the health district is trying to put together a steering committee for accreditation, and I saw your name on the short list, but the grant is just pretty new, like a few weeks old, and they're still trying to get all the pieces together. But one of the goals mentioned in the strategic plan when you're assessing the community is the strength of the relationship with the educational community. And so, you know, strengthening the bond with UNLV is going to be exceedingly important. Okay, thank you.